Hello everyone, this is Dr. Ahmed Abdulwahab and this is Highlights in Radiology. So guys, today we're gonna have an episode of epic proportions. It's completely different from everything that you've used to. First of all, I want to thank you very much for everything that you have done, for your efforts in supporting us and supporting this channel, for the nice suggestions and comments, and I took most of them into account into making this a new episode. Second, the amount of subscriptions that we got is amazing. However, keep in mind 62% of people watching us are not subscribers, so please hit that subscribe button. In order to help our channel get better and improve and increase in amount of followers and subscribers and watch time, I'm gonna make a new thing that is make you part of this channel. And how is that? Nowadays we have around 8,000 few hundred subscribers. So if by the end of November, that is on the 30th of November, if our subscriber number crosses the 10,000 subscribers, that's 10K, if you help me get the number of subscribers more than 10K by 30th of November, I will make a mini series for you explaining the brain CT from scratch, from nothing. But first you have to do your job and get me those 10Ks. In today's episode, we're going to talk about the radiologic features that help to distinguish whether a bone lesion is a benign or malignant. And at the end of the episode, there will be a short quiz of 5 cases. All you have to do is to write the case 1 benign, case 2 benign, whatever. You have to answer them, okay, and keep the answer to yourself. And on Wednesday at 5 p.m. I will post the answers with the explanations in order to get more interaction from you. Okay guys, so enough talking, let's go to business. So, as we said before, our topic today will be about the radiologic criteria that suggest a malignant bone neoplasms. A bone lesion is present on an X-ray or CT or MRI or whatever. What are the criteria that if you see it, you know this is a malignant bone neoplasm, or at least you suspect malignant bone neoplasms? Look for the following findings. Is there any features of bone destruction, especially if moth-eaten appearance or permeative pattern? But it also may be geographic, particularly if there is a wide zone of transition. So what does that mean? What's moth-eaten or permeative or whatever? This is what we mean by moth-eaten. You can see this bone, the humerus here, it's like eaten by some kind of an insect or something. It's moth-eaten, okay? It's completely eroded. Another example, you can see here, it's moth-eaten here and there and there and there. These are tiny spots, black spots that indicate a moth-eaten pattern. This is highly suspicious for malignant bone tumor. Which kind of malignancy is really not the problem. At the end, it will be a histopathologic diagnosis. And if you look here, you can see some pathologic fracture also indicating this is a malignant bone lesion. Another example, moth-eaten pattern. All of these bones are very finely eroded. There is a lot of tiny spaces, hypodense spaces, like an insect or a bug is eating the bone. And this is again a moth-eaten pattern. Now, it might not be very obvious as in the previous cases. In this case, for example, we have this part here that shows some area of decreased bone density, and this is what's called permeative pattern. This is a permeative pattern of bone destruction, also very suggestive of moth-eaten. Especially if you look carefully, there is this periosteal reaction. You can see here, what is this? It's not per se moth-eaten. It has some kind of irregular distribution associated with, of course, cortical destruction and whatever. We will talk about it in the coming slices, but this is what we call a geographic pattern of bone destruction, especially with what appears to be a wide zone of transition. You can see here this transition is not very sharp. If I draw it one time, it will be something like that. If I try to draw it again, it will be maybe different. If I to draw it again, it's different, or it will not be perfectly precise because the zone of transition is wide. You can see here it's wide zone of transition. This is a geographic pattern with a wide transition zone, very suggestive of a malignant bone lesion. Another example, you can see it also in CT scan, not only in the MRI. You can look here, and this is a geographic pattern of bone destruction. It's some sort of geography in it, and it has also evidence of cortical destruction here and there. So these are all criteria for detecting malignant. If you see it, you suspect a malignant bone lesion. The other feature that you look for is an irregular or ill-defined margins of the lesion, which is what we talked about in the slide before, a wide transition zone between the normal and abnormal bone. The normal bone and the abnormal bone are, there is a distance between the transition from the normal to abnormal. For example, you can see here, this is the lesion, of course, but this is a normal bone, I think. So the transition from the abnormal bone to the normal bone, it's a large distance. It's not very well defined. You cannot say, well, definitely this is a normal bone and this is an abnormal, or maybe this little bit is abnormal, or maybe this little bit is normal. It's not definite. So this is a wide zone of transition. Now, let's look at this example. Is this a wide zone of transition? No, of course. It's a very narrow zone of transition. You can draw it with a pencil. This is a normal bone, this is abnormal bone. So this is definitely not a malignant lesion. It has a very narrow zone of transition, very well demarcated. Let's look at another example. For example, here, is this a wide zone of transition? I don't think so. You can see it's very well demarcated, very sharp. So this is a benign bone lesion. It's not a malignant bone lesion. Again, this was this. Is it a wide zone of transition? It's very well demarcated, narrow zone of transition. So this is a benign bone lesion. It's not malignant. While if you look here, is this a wide zone of transition? Well, maybe this is an abnormal bone. Maybe this is a normal bone. I don't know whether here it's normal or abnormal. So this indicates a wide zone of transition from abnormal bone to normal bone. This is a malignant bone lesion, especially if you take into consideration the associated periosteal reaction. Again, let's see another example. You can see it here. There is a wide zone of transition from this abnormal bone to this normal bone. But where exactly does it stop or start? I don't know. It's a wide zone of transition of a malignant bone lesion. Another example you can see here. This is the lesion, and possibly this is a normal bone. So where does it stop and where does it start? Maybe here or here or here. It's not very clearly seen. So there is a wide zone of transition. Now, the other feature that you have to look for is any cortical erosion or destruction. Is the cortex eroded? Like here, you can see this cortex is not present. Here, for example, there is some cortex, but here it's destructed, it's eroded. This is a malignant feature. Again, look at that. This is a cortex, and this is a cortex, but where is it here? It's destroyed, it's eroded, it's not present because the tumor has destructed them, eaten them, eroded them. Again, what about here? Maybe this is a normal cortex, maybe, but what about the rest? The entire bone is involved with a malignant lesion. It's completely destructed, destroying the cortex and is eroding it, maybe. Okay, so this is a cortical erosion or destruction. Again, another example you can see here, this cortex is definitely abnormal. This is a normal cortex, but this one it's destructed and eroded due to malignant bony lesion involvement. Now, other feature is what we call Codman triangle. First of all, let me explain the basics of Codman triangle. First, you have a bone, and the bone is covered by periosteum. And then there is a tumor that is destroying and regrowing and trying to invade more bone. So what happens is the normal periosteum that's here will, this lesion is destroying and the periosteum will try to repair. Let me take another color, for example here. The periosteum tries to repair the damage and the lesion grows and the periosteum tries to repair and it grows and this try to repair. So at the end, we will end up with what? We will end up with this appearance. This is the cortex, this is the lesion, and here we have periosteum trying to repair is just basically forming a calcification, a callus. So we'll have a calcification or a callus at the edge of the tumor. This is what we call Codman triangle. So if you see it, there is an aggressive process that's trying to destroy the bone and the periosteum is trying to repair and resulting in this appearance. Let's see a few examples of that. For example, you can see here, as we explained, this is the tumor trying to repair. Of course, the cortex also is involved here. And this is the periosteum trying, the tumor trying to destroy and the periosteum trying to repair, forming this what we call Codman triangle. Now, let's look here. It might be very faint. It might not be quite obvious as we saw previously. If you look carefully, there is a thin Codman triangle here, and there is some permeative pattern here, indicating there is a malignant lesion with periosteal reaction forming a Codman triangle. Another example, it might be very prominent, like here. This is a big Codman triangle due to the big tumor destroying and invading the bone. So this is another feature of malignant involvement. Again, you might see Codman triangle on both sides of the bone, on both sides of the tumor. This is the abnormal bone, and you can see this tumor, the mass here, and a Codman triangle here, and a Codman triangle here. Another feature is suggesting malignancy is what's called periosteal lamellation or onion skin or onion peel appearance. Again, the idea is the same as in the Codman triangle. This is the bone, the tumor is growing, periosteum trying to repair. Then bone grows, then periosteum try to repair. Then the bone grows and periosteum try to repair. What you end up with is laminated pattern of periosteal reaction, what we call it onion peel or onion skin appearance. And it's very suggestive of a malignant process. For example, you can look here. There is multiple layers of periosteal reaction here and there, and these are what's suggesting malignant or aggressive process. It might be even dense, not necessarily lucent. You can see here, it looks dense, but again, it's a periosteal laminated appearance, and it can be very prominent like here, and you can see it's multiple layers of periosteal reaction and bone destruction, and reaction and bone destruction forming this appearance. And by the way, a lot of bone tumors that we see the periosteal skin, onion skin appearance, usually they are Ewing sarcoma. So when you see that, keep Ewing sarcoma at the top of your differential diagnosis. You can see the periosteal reaction also in MRI of this bone. You can see it's multiple layers of bone and periosteal reaction, and bone and periosteal reaction, and bone, and so long, so forth. Okay. Other feature is what we call sunburst appearance or hair on end appearance, or the scientific name is periosteal right angle speculation. Again, the same idea. This is the bone, the tumor is destroying and the periosteum is trying to repair in a vertical pattern. So what you end up with is sunburst. It's like the sun shining or something, or what's called hair on end appearance. And we will see a lot of examples of that. For example, here you can see this is a very typical hair on end appearance here and there, or what we call a sunburst appearance, and it is a very aggressive pattern of periosteal reaction. Of course, you have to comment also on the permeative pattern of bone destruction and the cortical irregularities. All of these features are suggestive of malignant bone lesion. Again, you can see here It's faint, but is there a malignant pattern of sunburst or hair on end appearance of periosteal reaction? Let's look at this another example. You can see it's very romantic sunrise, sunburst, and or hair on end appearance. Of course, unfortunately for the patient, it's a malignant lesion, and there's nothing romantic about that. Okay, now another example, you can see it in CT scan. You can see it's forming speculations or vertical periosteal reaction, or what we call a hair on end appearance. Now look at that. You can see both kinds of periosteal reaction, the hair or on end appearance or the sunburst appearance, and this is a Codman triangle. Here you can see it on both sides with the sunburst appearance. So all patterns of malignant periosteal reaction are present here. The seventh criteria to look for is a presence of a soft tissue mass adjacent to an area of bone destruction. So the presence of a soft tissue mass like that, you can see this is a big soft tissue mass with an area of a bony irregularity or abnormality. This is a suggestion of malignant bony lesion, especially if the mass is disproportionately large, like a very large mass with a very small malignant bone lesion. Keep in mind, Ewing sarcoma always makes this appearance of always associated with a very large periosteal mass. Again, we have the same patient we've seen before. There is an wide zone of transition, cortical destruction, and a big soft tissue mass surrounding the involved area. Okay, you can see it in the MRI. If you remember this slide from the last week episode, there is a big soft tissue mass. I will not tell you what was the histopathology of the mass. You have to tell me that if you watched the last episode. Again, in the MRI, you can see here there is a bony lesion destroying the bone, involving the bone with a soft tissue mass. And this soft tissue mass is also a feature suggesting a malignant bony involvement. And you can see here, well, the bone is abnormal, definitely. There is cortical thickening and destruction and whatever. But is there a soft tissue mass? Well, yes, there is. All of this is a soft tissue mass. There is a big, huge soft tissue mass associated with the bone. And how do you know that? Well, most of the times the patient will tell you there is a big swelling and big soft tissue mass in my thigh. You do an MRI for it and you end up with all of this of enhancing soft tissue mass. This is the same patient, by the way. Okay. Now, another feature is the presence of chondroid or osteoid matrix, especially in extraosseous tissues. You look for the chondroid or osteoid matrix in extraosseous tissues. Like, for example, here. What do we mean? First of all, what do we mean by osteoid matrix or chondroid matrix? You can see obviously there are rings and arcs of calcification within this bone. This is what we call chondroid matrix. Okay, now this is what we call osteoid matrix. You see, it's just painting with white color. There is a white fluffy color. This is osteoid matrix. Is what we call chondroid matrix, and this what we call osteoid matrix. So you have to memorize them. Osteoid is like fluffy, whitish, cottony color, while the chondroid is like rings and arcs and dots. Okay, so now let's see here. Is this a chondroid matrix or an osteoid matrix? Of course, this is a chondroid matrix. However, is this a malignant lesion? No, it's a benign lesion. It's an enchondroma. And why is that? First of all, there is no cortical destruction, no periosteal reaction, no soft tissue mass, and the calcification is within the bone, not in an extraosseous location. Okay, so keep in mind all the points together. Now look at that. Is that osteoid or chondroid matrix? It doesn't matter. It's, first of all, this is of course a chondroid matrix, but it doesn't matter because if it is osteoid or chondroid matrix, both of them are suspicious for malignancy. And you can see there is a wide zone of transition. There is some periosteal reaction here. You can see the geographical pattern of tumor distribution, confirming this is a malignant lesion with chondroid matrix. Again, very obviously here, chondroid matrix. There are multiple rings and arcs here and there, and it's basically in the extra osseous component, and there is an area of bone destruction and a large soft tissue component, confirming it's a malignant tumor. Okay, now let's look here. Is this osteoid or chondroid matrix? This is an osteoid matrix, just big blush of whitish cottony color, making the appearance of osteoid calcification or osteoid matrix and confirming this is a malignant lesion. Also, we can see the chondroid matrix in the MRI. You can see in this example, very nicely demonstrated chondroid matrix, rings and arcs, and in the MRI, it's very obvious. Of course, this is not a malignant lesion. This is a very benign lesion, but this is just a big chondroma because the cortex is preserved. There is no soft tissue extension. There is no cortical destruction, and it's well localized within the bone, and it has a narrow zone of transition. So all of these are benign features. Now, let's look at that. Is this benign or malignant? And is it osteoid or chondroid matrix? First of all, this is definitely a chondroid matrix, and it's definitely malignant because the cortex is destroyed, it's extending to the surrounding soft tissue, and it's eroding posteriorly, and there is a wide zone of transition. So all of the features are in favor of malignant lesion. Now, the last feature that we have to look for when we decide the bony tumor is benign or malignant is the presence of metastasis to distant site. Is there any metastatic lesions elsewhere? And when we say the metastasis to distant site, it can be to other bones. For example, metastasis to the vertebrae here and there. Also, we can see the metastasis here in this bone scan. All the vertebrae are hot. Everything is dense. In this PET scan, everything is sclerotic and dense. All the bones are involved by the tumor. So, of course, there is a malignant lesion here. All of the bones are involved by metastasis. And metastasis can be seen by X-ray. You can see there are innumerable sclerotic lesions here and there in the bones. And these are all metastatic lesions from whatever primary tumor he had. Okay, and metastasis can be due to other soft tissues, not only bones like here. These are very nicely demonstrated lung metastasis of osteosarcoma. Osteosarcoma commonly metastasized to the lung. In fact, most of the sarcomas commonly metastasize to the lung, especially osteosarcoma. It has a very high predilection for the lung, forming these large rounded lesions, and it's one of the most common causes of spontaneous pneumothorax in young adults. Keep that in mind. The examiners love it in the board exams. So now let's see another example, and you can see there is innumerable diffuse involvement of both lungs by variable size lesions, confirming diffuse bilateral lung metastasis. Are you ready for our quiz? I promised you we will have 5 slides. All you have to do is say benign or malignant and why. If you like to write it in the comments, that's okay. If you want to keep it to yourself, it's also okay. And on Wednesday at 5 p.m. Baghdad time, there will be a small or short video explaining the 5 cases and why they are benign or why they are malignant. Okay? Keep watching. I'm going to see you on Wednesday for the answers. So the first question is, benign or malignant? Is this lesion benign and malignant, and why? The second case, is this lesion benign or malignant? And tell me why, please. Is this case a benign or a malignant bony lesion, and why? And the fourth slide, Is this lesion benign or malignant, and why? And the final slide, is this lesion benign or malignant, and why? Keep in mind, if we cross 10K by the end of November, you will get a mini series about brain CT scan imaging and basic interpretation. Okay, so I know it's possible because 60% of people watching us are not subscribers, and now we have around 8,000 few hundred subscribers. So keep watching and write your answers, and on Wednesday you will have the result. Thank you very much. I'm Dr. Ahmed D, Abdulwahab, and this is Highlighting Radiology. See you on Wednesday, inshallah. Bye.